with the corporations and with all of the things that are happening, there's vast technologies that are also being brought out and tried and are part of the systems now in hospitals and clinics, one of which is electronic medical records. So do you have thoughts on that, Dr. Lindell?
If it comes to fruition, it will be a beautiful thing. With the touch of a button, you can get the patient's complete medical record transferred over the internet so that you have complete, their cardiac cath report, their x-rays, images, everything that you need at the touch of a button. If that comes about, that's a beautiful thing. I would hope that there would be not an associated upgrade cost and all the other things that goes with that.
I think EMR can be very useful in standardizing the medical reports across patient groups. The problem is it takes a lot of time. I find that physicians are spending as much time with the patient as they are documenting on EMR. And, there's got to be some improvement in that area. But I do think that EMR will improve healthcare in the long run. And I think it's inevitable, just with the way the society is going towards more of a technological state. I mean, I think some physicians would frankly prefer the good old pencil and paper and talking to the patient, spending more time with them and forming the bond. But unfortunately, it's not in our hands anymore. I mean, we're having to do it. Some are more easily adaptable to it than others, and it is taking up time, but I don't think there's any way out.
I mean, being in consult, sometimes we see physicians on a roller laptop typing as they go and making their rounds, and even in psychiatry, that's happening as well. Even in your initial office visit, our service agreements say that your physician will be typing on the laptop to do your notes, and this is a different kind of way to not have an expectation necessarily of a therapy kind of environment. And even with medication management, we're typing as we go. So it's quite a different thing. I find sometimes with electronic medical records, there's some pros and cons. There's often little one words that come out. There's all this data that's kind of around the narrative that we need or the follow-up. It's sometimes hard to even decipher. It's like a different language that I think sometimes loses effectiveness. When you want copies of records and you get all of these symbols and data and you get your little tiny narrative is at the bottom, you often wonder if we should go back to pen and paper.
Have you heard of the smart card that is used in Taiwan? It's a credit card sized card which has the entire medical history on it, physical, and every visit that the person makes. And whenever he goes, it's plugged into the computer and the doctor knows. And that visit is recorded. And so is the doctor's input. And he carries that.
I wake up in sweats at night for fear that this new clinic I'm going to is going to make me learn their EMR. There are as many companies making EMRs as there are in the city of Las Colinas. There are so many of them out there. And with me working in many different clinics as a locums, that's a fear I have. The most recent clinic I'm working at is letting me simply dictate when I come out of the room. They're not making me learn their EMR. And I have found I can see 10 patients an hour. I've never tried the dictating before. And I am amazed at how it takes me 2 minutes to dictate this visit, and I'm on to the next patient. I could see a tremendous amount of patients doing this. I love the dictating thing.